Most people who wake up with a dry mouth every morning have explained it to themselves already. They drank too much coffee yesterday. They did not drink enough water. They must have slept with their mouth open. The bedroom is too dry. They are getting older and everything just dries out a little more. These explanations are comfortable. They are simple. They require nothing. No doctor's appointment, no blood test, no change in how you think about your health. And for some people, they are accurate. But here is what nobody is telling you. For a significant proportion of adults, particularly those over 55, particularly those who experience this consistently rather than occasionally, those comfortable explanations are wrong. And the real explanation is one that, if known, would change how they understood their body and how they manage their health. I am Dr. Adam Smith. I am internal medicine specialist, and I want to tell you something that sits at the intersection of immunology, neurology, and metabolic medicine that most people have never considered about a symptom they have been dismissing for years. Your saliva is not simply moisture. It is an immune organ, and when it fails to produce adequately overnight, the body is communicating something about the state of that immune system and about the inflammatory and neurological environment that governs it that deserves your full attention. Here is the biology that reframes everything. Your mouth is the entry point for every pathogen, every allergen, every foreign compound you encounter through breathing, eating, and speaking. It is constantly exposed to the microbial world in a way that almost no other mucosal surface is, and it defends itself primarily through saliva. Saliva contains secretory immunoglobulin A, the most abundant antibody in the human body, produced specifically by the mucosal immune system. It contains defensins, antimicrobial peptides that disrupt bacterial and fungal cell membranes. It contains lactoferrin, an iron-binding protein that starves bacteria of the iron they need to proliferate. And it contains mucins, glycoproteins that trap pathogens and facilitate their removal through swallowing. When overnight salivary flow drops below its protective baseline, this entire immune infrastructure is compromised. The oral microbiome, normally kept in precise balance by the antibacterial proteins in saliva, shifts toward overgrowth of pathogenic species. Systemic inflammatory markers rise. The immune activation generated by oral dysbiosis sends signals throughout the body that compound whatever underlying process is already disrupting salivary flow. This is the gut-saliva immune axis, a bidirectional relationship between oral immune function, systemic inflammation, and the conditions that drive both. And it is the framework through which I want you to understand the 5 conditions on today's list. The American Academy of Immunology and the European Federation of Immunological Societies both recognize the oral mucosal immune system as a critical and frequently underestimated component of systemic immune regulation. And the research connecting systemic inflammatory conditions, autoimmune disease, neurological disorders, chronic immune activation, to salivary dysfunction is building rapidly. Before we count down, I need to tell you that number 3 on this list is a neurological condition that most people associate with much later stages than morning dry mouth. And finding it at the stage where dry mouth is its primary symptom is a genuinely meaningful opportunity. And number 1 involves a chronic inflammatory state that is so prevalent, so underdiagnosed, and so consequential that I believe most people watching this video have never had a proper conversation with a physician about it. Leave your age and your dry mouth experience in the comments now. And tell me, alongside the dry mouth, have you noticed any changes in your gut health, your immune function, or your overall energy levels? Those details matter more than you might expect for today's topic. The 5 conditions. Let's go through them. Before we begin, I want to acknowledge something. This topic sits at the more complex end of the medical education spectrum. The conditions I am about to describe involve immunology, neurology, and inflammatory biology that are not simple concepts. I am going to explain them as clearly and accessibly as I can, but I want you to stay focused because the mechanisms I am describing are the specific reasons why each condition produces morning dry mouth. Understanding the mechanism is what makes the information useful. It is what allows you to go to a physician and say something specific and informed rather than something vague and easily dismissed. Each condition comes with the mechanism, the evidence, and the action step. We go from 5 to 1, and number 1, as I said at the opening, involves a systemic inflammatory condition that most people watching this video have never had properly investigated. Let's count them down. Understanding the causes is only part of the picture. The real question is, what do they lead to? In this section, we're going to break down the 5 key conditions that often develop when these factors are left unaddressed. Number 5. Gut microbiome dysbiosis and the oral gut axis. The signal: your gut bacterial ecosystem is disrupted, and that disruption is expressing itself in your mouth overnight. This is the entry on today's list that most people find most surprising, because the gut and the mouth seem, on the surface, like entirely separate systems. But the research of the last decade has established something remarkable. The gut microbiome and the oral microbiome are in continuous, bidirectional communication, and disruption of one consistently disrupts the other. The mechanism operates through multiple pathways. First, the oral gut microbial transit pathway. Approximately 10 billion bacteria are swallowed from the mouth into the gut every day, meaning that shifts in oral microbial composition directly influence gut microbiome diversity. Second, the systemic immune pathway. Gut dysbiosis generates systemic inflammatory cytokines that travel through the circulation to the salivary glands and alter the composition and volume of saliva produced. Third, the enteric nervous system salivary axis. The enteric nervous system of the gut communicates with the autonomic nervous system through the vagus nerve, and dysregulation of this communication affects parasympathetic salivary drive. When the gut microbiome is disrupted through antibiotic use, highly processed diet, chronic stress, or pathological overgrowth of non-commensal species, the resulting systemic inflammatory signal consistently reduces salivary flow, alters salivary antimicrobial protein composition, and promotes oral dysbiosis that further compounds the systemic inflammatory burden. A 2022 study published in Cell Host and Microbe found that adults with confirmed gut microbiome dysbiosis, characterized by reduced lactobacillus and bifidobacterium populations alongside overgrowth of proteobacteria, had significantly altered salivary immunoglobulin A levels and reduced unstimulated salivary flow rates compared to controls with healthy microbiome profiles. The researchers specifically identified the systemic inflammatory cytokine pathway as the primary mechanism linking gut dysbiosis to salivary dysfunction. A stool microbiome analysis, now widely available through both clinical and direct-to-consumer testing, can identify dysbiosis patterns. A diet rich in prebiotic fiber, fermented foods, and polyphenol-rich plants supports microbiome diversity and reduces the inflammatory signaling that suppresses salivary function. Probiotic supplementation with clinically validated strains, particularly Lactobacillus rhamnosus GG and Bifidobacterium longum, has evidence for both gut and oral microbiome benefits. Number 4. Autoimmune thyroid disease, Hashimoto's thyroiditis. The signal: your immune system is mounting a chronic inflammatory attack on your thyroid, and the collateral immune activation is affecting your salivary glands. Hashimoto's thyroiditis is the most common autoimmune disease in the developed world, affecting an estimated 14 million Americans, with a 10-to-1 female predominance. It is the primary cause of hypothyroidism in iodine-sufficient populations. And like Sjogren's syndrome, which I will discuss in a moment, it produces morning dry mouth through both a direct and an indirect mechanism. The direct mechanism, as Hashimoto's progressively damages thyroid tissue through lymphocytic infiltration, thyroid hormone output declines. As I described in the previous video, thyroid hormones are required for normal salivary acinar cell secretory activity. As T3 and T4 levels fall, often gradually, over years, salivary output declines proportionally. The indirect mechanism is less widely recognized and more specifically relevant to the immunological framework of today's video. Hashimoto's is associated with what immunologists call bystander autoimmunity, the tendency for the immune dysregulation that drives one autoimmune condition to activate immune responses against other tissues simultaneously. In a subset of Hashimoto's patients, estimated at 15 to 20%, secondary salivary gland immune activation occurs alongside the thyroid attack, producing a degree of direct salivary gland dysfunction that compounds the hormonal mechanism. A study published in Thyroid The Journal of the American Thyroid Association found that adults with Hashimoto's thyroiditis had significantly lower unstimulated salivary flow rates and higher salivary inflammatory cytokine concentrations than age-matched controls, even after controlling for thyroid hormone levels. The researchers concluded that salivary dysfunction in Hashimoto's involves both hormonal insufficiency and direct immune-mediated glandular inflammation, making it a more complex and treatment-resistant form of dry mouth than straightforward hypothyroidism. If you have morning dry mouth alongside fatigue, cold intolerance, hair loss, or unexplained weight changes, request a thyroid panel that specifically includes thyroid peroxidase antibodies and thyroglobulin antibodies alongside TSH and free T4. Standard thyroid panels often omit the antibody tests, but it is the antibodies that confirm Hashimoto's rather than simple hypothyroidism, and the distinction matters for management. Number 3. Early Parkinson's disease and neurological conditions. I want to be precise about how I present this entry, because I am not suggesting that morning dry mouth means you have Parkinson's disease. I am saying something more specific and more useful, that in a subset of adults who develop Parkinson's disease, morning dry mouth appears as a symptom during the prodromal phase, the years before the motor symptoms that define the clinical diagnosis become apparent. And identifying it at that stage represents a potentially meaningful opportunity. The signal, autonomic nervous system dysfunction, a hallmark of early neurodegeneration, is impairing the nerve-mediated control of your salivary glands. Parkinson's disease is not primarily a motor disorder. It is a synucleinopathy, a disease characterized by the accumulation of misfolded alpha-synuclein protein in neurons throughout the nervous system, including, crucially, in the autonomic nervous system. The autonomic symptoms of Parkinson's, constipation, anosmia, REM sleep behavior disorder, and orthostatic hypotension, are now well established as prodromal features that precede motor symptoms by years or even decades. Salivary dysfunction fits within this autonomic symptom cluster. The parasympathetic nerves supplying the salivary glands are among the autonomic pathways affected by early alpha-synuclein pathology, and the result is a progressive impairment in salivary secretion that manifests as dry mouth, particularly overnight when parasympathetic tone is already naturally reduced. This is why Parkinson's patients famously drool, not because they produce excess saliva, but because their swallowing reflex is impaired. They may simultaneously have reduced salivary production and impaired clearance, a combination that produces variable oral moisture symptoms. A landmark study published in The Lancet Neurology found that autonomic symptoms, including dry mouth, constipation, and orthostatic hypotension, preceded motor diagnosis in Parkinson's disease by an average of 4.7 years. A 2023 study in JAMA Neurology found that adults with a combination of REM sleep behavior disorder, anosmia, and dry mouth had a significantly elevated risk of prodromal Parkinson's diagnosis compared to those without this symptom cluster. If morning dry mouth is accompanied by loss of smell, acting out dreams during sleep, increasing constipation, or a fine tremor at rest, mention this specific symptom cluster to your physician. A referral to a neurologist for assessment is appropriate. I want to be clear, the vast majority of people with morning dry mouth do not have prodromal Parkinson's. This is one of 5 causes and not the most common, but it is the one where early recognition carries the greatest neurological significance. Number 2. Chronic systemic inflammation and inflammatory arthritis. The signal, a chronic whole-body inflammatory state, is disrupting your immune-regulated salivary function. This entry covers a spectrum of conditions united by a common mechanism: chronic systemic inflammation, the persistent elevation of pro-inflammatory cytokines including TNF-alpha, IL-6, and IL-1-beta. That is the defining feature of inflammatory arthritis conditions including rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. Most people who live with these conditions are familiar with their joint manifestations. But chronic systemic inflammation does not confine itself to joints. It circulates, literally, through the bloodstream, reaching every organ and tissue system in the body. And among the most consistently affected non-joint tissues in inflammatory arthritis is the salivary glandular system. The mechanism is multi-layered. First, the elevated circulating cytokines, particularly TNF-alpha and IL-6, directly suppress the secretory activity of salivary acinar cells through cytokine receptor-mediated inhibition of the intracellular signaling cascades that drive fluid and electrolyte secretion. Second, the vascular inflammation characteristic of inflammatory arthritis reduces perfusion of peripheral glandular tissue, including the parotid and submandibular glands. Third, the medications used to manage inflammatory arthritis, including methotrexate, sulfasalazine, and hydroxychloroquine, carry their own salivary gland side effects in a proportion of patients. A meta-analysis published in Annals of the Rheumatic Diseases found that dry mouth, measured by both unstimulated salivary flow rate and patient-reported symptom scores, was significantly more prevalent in adults with rheumatoid arthritis than in age-matched controls, even after excluding patients with concurrent Sjogren's syndrome. The association was strongest in patients with higher circulating TNF-alpha levels, directly implicating the cytokine-mediated suppression mechanism. A separate 2022 study in Arthritis Research and Therapy found that anti-TNF-alpha biologic treatment in rheumatoid arthritis patients produced significant improvements in salivary flow rates alongside improvements in joint disease activity, confirming the direct relationship between systemic inflammatory burden and salivary gland function. If you have diagnosed inflammatory arthritis and experience persistent dry mouth, discuss salivary symptoms specifically with your rheumatologist. Optimal inflammatory disease control, achieving low disease activity or remission through biological therapy where appropriate, is the most effective intervention for the salivary component. Additionally, screening for concurrent Sjogren's syndrome is warranted, as the two conditions co-occur at rates significantly above chance. Number 1. Chronic sleep inflammation and undiagnosed autoimmune activation. And here is number 1. The condition I told you at the opening of this video that most people watching have never had a proper conversation with a physician about. I am not going to name a single disease here, because what I want to describe is something broader and in some ways more important than any individual diagnosis. I want to describe a state that precedes many of the conditions on today's list, that is extraordinarily prevalent in adults over 50, that is almost never discussed in routine medical care, and that produces morning dry mouth as one of its most consistent early expressions. That state is chronic low-grade immune activation, a persistent, subclinical inflammatory condition in which the immune system maintains a degree of activation that does not meet the diagnostic threshold for any specific autoimmune disease, but that produces measurable biological effects on every tissue system it touches, including the salivary glands. Immunologists measure this state through a panel of biomarkers: C-reactive protein, erythrocyte sedimentation rate, homocysteine, fibrinogen, and a growing list of inflammatory cytokines. In adults with chronic low-grade immune activation, these markers are elevated above the optimal range, not dramatically, not in a way that triggers clinical concern in routine testing, but consistently, persistently, and meaningfully. The sources of this chronic activation are multiple. Poor sleep quality and sleep fragmentation activate the NF-kappa B inflammatory pathway, a master transcription factor for pro-inflammatory gene expression, producing cytokine elevations that persist throughout the day following a disrupted night. Visceral adipose tissue, abdominal fat, functions as an endocrine organ, secreting TNF-alpha, IL-6, and leptin continuously. Periodontal disease, which is itself driven partly by salivary deficiency, creates a chronic oral bacterial infection that drives systemic immune activation through bacteremia and lipopolysaccharide exposure. These sources of immune activation are interconnected and self-reinforcing. Poor sleep drives visceral adiposity. Visceral adiposity drives inflammation. Inflammation drives poor sleep. And all of it converges on the salivary glands through the cytokine-mediated suppression pathway, producing the morning dry mouth that is one of the most consistent and yet most overlooked expressions of this systemic inflammatory state. A prospective study published in Nature Communications followed over 4,000 adults over 60 for 8 years, measuring inflammatory biomarkers at baseline and tracking the development of clinical autoimmune and metabolic conditions over the follow-up period. Adults with elevated baseline CRP and IL-6 in the absence of any clinical diagnosis, the chronic low-grade immune activation phenotype, had significantly higher rates of salivary dysfunction at baseline and significantly higher rates of clinical autoimmune diagnosis during follow-up compared to those with low inflammatory markers. The researchers described chronic low-grade immune activation as a pre-diagnostic state for multiple autoimmune conditions, a period during which the immune system is already functionally dysregulated but has not yet produced the specific tissue damage that triggers clinical diagnosis. Morning dry mouth, they concluded, was among the most consistent symptomatic expressions of this pre-diagnostic state. A 2023 study in immunity and aging specifically examined the relationship between inflammatory biomarker levels and salivary flow rates in adults over 55, finding a strong, dose-dependent inverse relationship between CRP levels and overnight salivary production. The researchers concluded that morning dry mouth could serve as a practical, non-invasive clinical indicator of the inflammatory burden that warrants formal investigation. Request an inflammatory biomarker panel from your physician. This should include high-sensitivity CRP, not standard CRP, which misses the subtle elevations of chronic low-grade activation, alongside IL-6, homocysteine, and fibrinogen. These are inexpensive tests, widely available, and rarely ordered in routine wellness checkups unless specifically requested. If your results show even modestly elevated inflammatory markers, above optimal but below clinical alarm thresholds, take them seriously. Discuss them with your physician as a pattern worth addressing rather than a number to watch, and address the modifiable drivers. Improve sleep quality. Every hour of fragmented sleep drives NF-kappa B activation the following day. Reduce abdominal adiposity through dietary and movement strategies. Visceral fat is the most inflammogenic tissue in the body per gram and the most responsive to intervention. Address periodontal health. Regular dental care is not cosmetic when the oral bacteria driving gum disease are also driving systemic inflammation through your bloodstream. The morning dry mouth you wake up with may be the earliest, quietest expression of a chronic inflammatory state that your future health will be significantly shaped by. Identifying and addressing it now, at the pre-diagnostic stage, is a genuinely different outcome than waiting for it to declare itself through a specific disease diagnosis years from now. Understanding the problem is important, but action is what creates change. Here are 5 powerful steps you can take starting today to address what we've discussed and move toward better health. Step 1. Request a high-sensitivity inflammatory biomarker panel. Ask specifically for high-sensitivity CRP, IL-6, homocysteine, and ESR. These are not part of most standard wellness blood panels. You need to request them specifically. The results give you and your physician a direct window into the chronic inflammatory state that may be driving your salivary dysfunction. Step 2. Prioritize sleep quality as an immune intervention. Sleep fragmentation is one of the most potent drivers of NF-kappa-mediated immune activation available in everyday life. And improving sleep quality is one of the most powerful anti-inflammatory interventions with the best evidence base. Target 7 to 8 hours of consolidated sleep. Address any factors disrupting sleep architecture, screen exposure, late caffeine, irregular sleep timing, with the same urgency you would apply to a medication with equivalent effects on inflammatory markers. Step 3. Support your oral microbiome actively. The oral microbiome is the front line of your mucosal immune system, and its health is directly relevant to both your morning dry mouth and your systemic inflammatory burden. Xylitol-containing products, gum, lozenges, mouth rinse, reduce the adhesion of pathogenic oral bacteria without disrupting commensal species. Oil pulling with sesame or coconut oil has emerging evidence for oral microbiome modulation. Regular flossing reduces the periodontal bacterial load that drives systemic immune activation through bacteremia. Step 4. Reduce visceral adiposity through diet and movement. Visceral adipose tissue, the fat stored around abdominal organs, is the primary endogenous source of chronic inflammatory cytokine production in most adults. Reducing it has a more powerful anti-inflammatory effect than most pharmaceutical interventions. A dietary pattern emphasizing whole foods, high fiber, and reduced ultra-processed food intake, combined with regular moderate-intensity physical activity, produces meaningful reductions in CRP and IL-6 within 8 to 12 weeks. Step 5. See your dentist and your physician in the same month. The oral systemic inflammatory connection means that these two appointments are not independent. Ask your dentist to assess your periodontal health specifically, not just your teeth. And ask your physician to review your systemic inflammatory markers. Bringing the findings from both appointments together gives you a picture of the oral immune connection that neither clinician can provide alone. There is a concept in immunology called the inflammatory threshold, the level of chronic immune activation below which the body compensates effectively, and above which the damage begins to compound faster than repair can keep pace with. Most people who develop autoimmune disease, metabolic disease, or cardiovascular disease spend years, sometimes decades, at or above that threshold before the damage declares itself through a diagnosis. They feel less well than they used to, more fatigued, more prone to infections. Their recovery from minor illness takes longer. Their sleep is less restorative. Their morning is less refreshed. And their mouth is dry when they wake up. None of these things, individually, seems like a medical emergency. Together, as a pattern evaluated through the lens of what the immune system is doing, they are a remarkably consistent picture of a body operating under chronic inflammatory load that is building towards something. The question is whether that something is identified and addressed early, while the biological changes are still largely reversible and the interventions available are most effective, or late, when the disease has declared itself and the options have narrowed. Everything I have described today points toward early. Morning dry mouth, evaluated seriously and investigated properly, can be the symptom that opens that early conversation, the one that prompts the blood panel that reveals the inflammatory markers, the one that leads to the autoimmune antibody screen that catches Hashimoto's or Sjogren's years before more serious manifestations appear, the one that generates the referral that identifies prodromal neurological change at a stage where intervention is meaningful. Your body is not dramatic. It does not begin with emergencies. It begins with whispers, persistent, consistent, quiet whispers, in the form of symptoms that seem too ordinary to matter. Listen to the whisper. Leave your age and your experience in the comments below. Has anything from today's video connected with something you have been noticing and not quite naming? I want to know, and this community benefits from your honesty. Share this video with someone who wakes up dry every morning and has never questioned why. You may be giving them the framework that leads to the conversation that changes how their next decade unfolds. Subscribe for weekly content on immune health, systemic inflammation, and the early signals your body sends before it needs to speak louder. Your immune system is protecting you every second of every day. Give it the attention it deserves.